Hey everyone, so if you're looking for all you need to know about orthotics for your cycling needs, the ultimate orthotic cycling guide, this is it. I'm Dr. Alex Ritza. I am a bike fitter and corrective chiropractor in Toronto, sometimes called the cycling doc. I specialize in my practice of taking care of everybody, but I see a lot of cyclists. We take care of a lot of cycling related issues. We do a lot of bike fits. For people ranging from those that say win the Zwift Academy to regular old folks. So if we're going to talk about orthotics and the difference between regular insole, non-custom orthotic bought off the shelf, and really excellent custom orthotic made by your bike fitting chiropractor, we got to talk about the purpose of the orthotic. So when we look at this physique insole that comes with your regular shoes, this thing does nothing. This little bump here that's supposed to simulate some support, it doesn't do very much. This is just providing an extra layer of tissue paper or comfort so that your foot doesn't hurt. The problem with this guy is that if your foot requires some structural support to prevent collapsing in the arch or to modify your cycling stroke to minimize an injury, or if you have a really high arch and there's no contact with the foot, this is going to do none of those. And so we have to talk about the purpose of an orthotic and why it's different from this custom guy, where we can add modifications like this varus wedge. We can put a metatarsal bump. We have a very stiff orthotic that is not going to move under 200 pounds of weight or 1,000 watts of power and is going to hold the arch up. So the purpose of the orthotic is basically to improve comfort by making a more contiguous, or contiguous is the wrong word, more even point of contact. Pressure is force and area. There will be less pressure, fewer hot spots on the foot if we evenly distribute the force over a greater area. So with a custom orthotic, we can mold it directly to the shape of the foot so that there's a more even distribution of pressure, versus there'll be no even distribution of pressure here because this thing is flat, it does nothing, the foot will do what it wants. This non-custom option, if you have the exact same shape as this non-custom orthotic, it might help to distribute pressure, but again, you'd have to be at that specific point on the bell curve. It will provide more support, more contact with the foot, especially if you have a very flat foot that's just going to fold and lay flat on this orthotic. But if you have a higher arch or a weird shape to your foot, like forefoot varus or forefoot valgus, it will not form a continuous, even contact on the foot. So, purpose of an orthotic number one, more even contact. Purpose of an orthotic number two is injury resistance or resilience, or to decrease pain. In some cases, we are going to use an orthotic to modify the cycling stroke. When I'm doing a bike fit, we put lasers on people's knees. I'm not so concerned about the knee going up and down exactly through the laser. I'm really concerned about the knee moving up and down, period. If it's a little in, a little bit out of the laser, no big deal. But I am concerned when the knee starts chopping. And so if somebody is textbook perfect, middle of bell curve, they might get away with this non-custom insole, which is the crappy insole that comes with your shoe that provides no support. And if the alignment of your lower limb, the alignment of your foot is really neutral, you have no forefoot, rear foot valgus, you have no odd Q angle or Q factor, then you might get a really nice up and down stroke. Sometimes, however, we need to build in some wedging or some support in the arch to especially prevent inward collapse of the knee. And so we can use the orthotic, building in some wedging and the arch support to prevent collapse inwards of the knee or some movement sometimes at the hip. So how that works is with building in a wedge or more structural support, we are going to minimize any collapse or pronation of the arch in the foot by limiting forefoot varus or valgus, or if somebody's arch really collapsed and falls down, then we can use that orthotic to minimize that valgus force at the knee where it collapsed inwards. Great way to create some knee pain. This non-custom orthotic with a small area of support, it makes it look larger because there's this wing here that sticks out and has no structural integrity. The orthotic is actually much smaller than it looks. It's a little bit deceiving. This will provide a little bit of arch support, minimize a little bit of collapse, might help with some knee tracking. Might. The third thing we're looking for with an orthotic could be put into the power cycling stroke category. Now, the research on increasing power output from using orthotics, not great. But hear me out on this. The purpose of an orthotic and what the research shows is that it's not just about maintaining a structural position by putting volume under the foot to fill in gaps. It's largely about proprioception. So imagine you're a cave person, and this is where a lot of barefoot running talk comes from. If you're a cave person, you're walking barefoot, your foot is sinking into the grass, it's sinking into the dirt. When the ground touches the bottom of the foot, it sends a ton of proprioceptive or sensory information up to your brain. The brain goes, ooh, I can really feel the grass, I can feel the bottom, I know how to move the foot to accommodate for any unevenness and really maximize my efficiency, control the muscles in the right way, and maybe in the case of cycling, improve my power output. So if you say have a very high arch, or you have some wedging or some varus valgus in the foot, there will be some gaps under the foot. Gaps under the foot means that the brain is not getting proprioceptive information from the foot because nothing is stimulating the skin. The skin is in no man's land, the foot's in no man's land, nothing touching it. No touch means no stimulation, means no feedback to the brain, means that the muscles do not coordinate and activate in the right pattern or as efficiently as they could. So we know from research, particularly with walking and gait, that orthotic largely works by stimulating the undersurface of the foot, which changes the brain's interpretation of what's happening, which changes its output, which largely leads to better muscle coordination and activation of the muscles that go down to the ankle and to the foot. So, when I use an orthotic, we're looking for better stroke modification to make sure that we can minimize repetitive strain and injury, more comfort in the foot, a more even distribution of force, and then we're also trying to maximize the efficiency of the cycling stroke or of the pedal stroke by providing more proprioceptive feedback up to the brain. I hope that wasn't too boring. So, if you are one of those people that's kind of middle of the bell curve, your bike foot is decent, you might get away very well with no orthotics. It might not be as efficient, it might not be as comfortable, it might not be as effective or injury resilient, but you might get away. As you move farther away on the bell curve in your body, your anatomy is a little bit more unique. That's where people might struggle a little bit more with their feet, with their cycling stroke. Those cases will benefit often from having some sort of support in the foot. So that's where a lot of people will go to a G8, a Superfoot, or whatever the heck that was sold to me here to provide a little bit more support in the arch. Now, if you're using a G8, those things are fine. They can move the arch around to provide more continuous support. I like that. I don't have a G8 to show you here, but they don't have any structural support. They're kind of like our non-custom guy where if you press on them, they don't have a lot of structural support. They're not going to really hold the foot up. This non-custom one, it does have more support. It does do a pretty good job of holding the foot up, but it might not match your arch perfectly because, again, it is not custom. Better than nothing in a lot of cases. Might increase comfort, might increase pedal stroke efficiency, might increase injury resilience, don't know. That is between you and your bike fitter or you and your own experience. Now, Doing a custom orthotic. Custom orthotic should always, like a bike fit, start with a really thorough assessment where we're going to look at arch height. We're going to look at how the arch collapses when you bear weight. In my bike fitting process, if we see more than a 0.75 size of a shoe change from non-weight bearing to weight bearing, especially if it's a full size change, that person should have an orthotic, custom, better than non-custom. Why? Because this guy has way more support. It barely bends when you move it. It is a very solid piece. If you're deforming the orthotic every single time you push down on the pedals, that means you are losing force to deform the orthotic and not to move the pedal. I don't think anybody wants to be losing force when we are spending thousands and thousands of dollars to get more aerodynamic bikes, jerseys, helmets, etc. With a custom orthotic, we're also going to make sure that the shape of the orthotic exactly matches the shape of your foot so that you have a more even distribution of force. And then the purpose of a custom orthotic is that we can add modifications like a metatarsal button. We could add wedging to the back of the orthotic, but most often I will be adding wedging to the front of the orthotic, where we're going to make typically the inside under the big toe thicker than the outside under the pinky toe. And that's because more people tend to have more forefoot varus, where their big toe is not in contact with the ground when their heel is in contact with the ground. And again, that is going to raise up the pedal or the shoe to meet the bottom of the foot for better proprioception, better support, more continuous contact, more comfort. And so if somebody is assessing you from orthotics, they should be watching you walk. They should be looking at the static shape of your foot. They should be looking for forefoot varus, forefoot valgus, rear foot varus, rear foot valgus. They should be looking to see if the metatarsals in the foot are collapsed or have a nice rounded shape. They should be measuring the size of the foot and seeing how much it collapses, and not just saying, oh, your arch collapses when you stand up. Let's get some numbers here. Let's make it quantitative. Let's have some threshold of where an orthotic is going to be really beneficial for providing structural integrity. An assessment for varus valgus should never be done statically. There's a couple bike fitters I know in Toronto that are going to have people sit. They're going to measure how their foot is shaped statically. Last time I checked, cycling is not a static endeavor. This should be done dynamically. And when you are getting orthotics made, custom, it should be done with the bike. When somebody comes in, if they want to just have cycling orthotics made, they don't want to pay the extra money to have me look at them on the bike, there is a large asterisk that the orthotics might not be as effective, because it is very difficult to make an orthotic from a static dynamic assessment of walking and in the office without seeing you on the bike. When we see somebody on the bike, we can add modifications like putting wedges here to try to figure out exactly what the custom orthotic is going to look like. And that's the other benefit of having a custom orthotic, is we can MacGyver during a bike fit wedges and different solutions. We can tape these on. Sometimes we put the more green varus or valgus wedges into the front of the foot to mimic a custom orthotic if somebody doesn't want to or have the money to spend on the custom orthotic. And it's still going to do a pretty good job, but it just might come off, it might shift, it might move, it might not be as custom, as effective. But it still is better than nothing in a lot of cases. So, custom orthotics. Sometimes when we're doing a bike fit, I will say to people they are needed, they would be comfortable, or they're not needed. Now, I'd say most people do not need them for a very good fit. They might really, really benefit from them. They might need a non-custom orthotic with some modifications for the best possible bike fit, but it's pretty rare where somebody would do just as well with what comes with the shoe as with an orthotic. And obviously, more support, more structural congruency, more pedal stroke modification. So there's no way to tell, frankly, whether you would benefit from an orthotic or it's needed without doing a bike fit, and hopefully your bike fitter is looking at your shoes. I would never ride without orthotics now, because when you use them, it's kind of like when you go from mechanical to electronic gearing. It just feels a lot better and it's a lot more comfortable. And frankly, I find it a lot more injury resilient for my pedal stroke. But that's just me. So guys, I hope that was helpful. If you have any questions, comments, concerns, leave them below. I hope that your cycling is going well this season. I'll see you out on the road. Take care.